These are examples of basal cell carcinoma, which is the most common type of skin cancer. More than 3.5 million new skin cancers are diagnosed in more than 2 million people each year in the United States. Approximately 1 in 5 Americans will develop skin cancer in their lifetime based on current data. Basal cell carcinomas tend to be either a pearly, erythematous patch or eroded plaque or nodule on the areas that see the sun the most, the head and neck, hands and arms, but they can develop anywhere. These are examples of basal cell carcinomas. Squamous cell carcinomas account for a smaller percentage of skin cancers. There are approximately 20% as many squamous cell carcinomas as there are basal cell carcinomas. Basal cell carcinomas rarely metastasize or spread to other parts of the body. Squamous cell carcinomas have a bit higher risk of metastasis, especially when they're located in certain areas, including the ears, lips, hands, and genitalia. Squamous cell carcinomas tend to be erythematous or red, scaling or heaped up with a nodule or thickened warty-like growth. Actinic keratoses are precancerous lesions which can eventuate into squamous cell carcinoma. Actinic keratoses are frequently treated by liquid nitrogen or topical chemotherapies or sometimes photodynamic therapy. This helps to prevent the development of a squamous cell carcinoma. These are examples of malignant melanoma. The incidence of melanoma has been increasing for the last 30 years. Melanoma incidence in whites is 5 times higher than incidence in Hispanics and 20 times higher than those of African American heritage. Before age 40, melanoma incidence is higher in women, but after age 40, the incidence in men is twice that in women. It's the most common form of cancer for young adults 25 to 29 years old and second most common form of cancer in adolescents. While melanoma accounts for only 4% the total number of skin cancers, it accounts for 75% of the deaths associated with skin cancer. Melanomas tend to be an atypical appearing pigmented lesion. We describe the ABCDs of melanoma, which stands for asymmetry, irregular border, varied color, and large diameter. To this, you should also add E for evolving. So any changing mole should be evaluated, and any mole that has any of those other features should be evaluated by your dermatologist. And the key thing is, melanoma can be 100% survivable if it's picked up at an early stage. So if you notice a changing mole, or you notice a mole that appears atypical, don't delay, see your dermatologist.